Neurology questions 1. 1. A nurse has applied a hypothermia blanket to a client with a fever. The nurse would inspect the skin frequently to detect which complications of hypothermia blanket gives. 1. Skin breakdown. 2. Frostbite. 3. Arterial insufficiency. 4. Venous insufficiency. The correct answer is 1. Skin breakdown. 2. A nurse is caring for unconscious client who is experiencing persistent hyperthermia with no signs and symptoms of infection. The nurse interprets that there may be changes in the client's thermoregulations. Center in which structure? 1. Cerebrum, cerebellum. 3. Hippocampus. 4. Hypothalamus. The correct answer is 4. Hypothalamus. 3. A nurse is caring for a client with an intracranial pressure monitoring device. The nurse would become most concerned if the ICP reading drafted and stayed in the vicinity of which level? 1. 3 mm Hg, 2. 8 mm Hg, 3. 11 mm Hg, 4. 15 mm Hg. The correct answer is 4. 15 mm Hg. 4. A nurse is planning care for a client with intracranial pressure monitoring. Which of the following intervention would be contraindicated in the plan of care? 1. Using strict aseptic technique when touching the monitoring system. 2. Assessing the incision site for signs and symptoms of infection. 3. Leveling the transducer at the lowest point of the ear. 4. Checking all stopcocks and connections for leaks. The correct answer is 4. Checking all stopcocks and connections for leaks. 5. A client is being hyperventilated by a mechanical ventilator to decrease the client's intracranial pressure. The nurse would plan to monitor arterial blood gas results and reports values that are outside of which of the following ranges? 1. PaO2 60 to 100 mmHg, PaCO2 25 to 30 mmHg. 2. PaO2 60 to 100 mmHg, PaCO2 30 to 35 mmHg. 3. PaO2 80 to 100 mmHg, PaCO2 35 to 40 mmHg. 4. PaO2 80 to 100 mmHg, PaCO2 25 to 30 mmHg. The correct answer is 4. PaO2 80 to 100 mmHg, PaCO2 25 to 30 mmHg. A nurse is providing care to a client with increased intracranial pressure. Which of the following approaches may not be beneficial in controlling the client's ICP from an environmental viewpoint? 1. Maintaining calm atmosphere. 2. Reducing environmental noise. 3. Clustering nursing activities to be done all at one time. 4. Allowing the client's uninterrupted time for sleep. The correct answer is 3. Clustering nursing activities to be done all at one time. 7. A home care nurse is making extended follow-up visit to a client discharged from the hospital following a moderately severe head injury. The family states that the client is behaving differentially than before the accident. The client is more fatigue and irritable and has some memory problems. The client, who was previously very even-tempered, is prone to outbursts of temper now. The nurse consults the family based on the understanding these behaviors. 1. Are short-term problems that will resolve in about a month. 2. Will probably be long-term sequelae of the injury. 3. Indicate worsening of the original injury. 4. Will come and go as intracranial pressure changes. The correct answer is 2. Will probably be a long-term sequelae of the injury.